wonderful to have so many of you participating. I'm Steve Mondrenock, and I'm Executive Director of the Association of Food and Drug Officials, and we're pleased to be able to bring to you this webinar this afternoon. We note the webinar is being recorded and will be made available after the fact for those that may not have been able to participate, or if you'd like to take another look later. We greatly appreciate your participation today. So we'll go ahead and get started right now and introduce our participants. Our presenters today will be Mara Burr. Mara joined the U.S. Food and Drug Administration in October of 2016 as the International Food Safety Policy Manager to lead the Public Health and Trade Team on International Affairs for the Office of the Center Director and the Center for Food Safety or Applied Nutrition, or CFSPAN. The Public Health and Trade Team develops policy on public health and trade issues addressing sanitary and phytosanitary measures consistent with U.S. obligations at the World Trade Organization and bilateral trade agreements, analyzing whether trading partners are properly implementing SPS measures based on science and to protect public health. Ms. Burr leads the effort to implement CFSPAN's food export certification program, including the legal, regulatory, and administrative requirements, as well as outreach to foreign governments. I'm just going to hit a couple highlights in her career, which is extensive in the area of international relations work. Ms. Burr served as the Deputy Assistant United States Trade Representative for South and Central Asian Affairs from 2010 to 2014. And also from 2004 to 2010, Ms. Burr served as the Deputy Assistant United States Trade Representative for Environmental and Natural Resources. Amy, do you want to hit mute on our new attendees, except for Kate and I? Also, thank you. Kate Meck is our second speaker today, and Kate is an international policy analyst with the International Affairs staff at FDA's Center for Food Safety and Applied Nutrition. She manages CFSPAN's export certification program, which includes the coordination of export certification activities, alignment of policies across program offices, and consolidation of information technology and administrative functions. Prior to her current position, she spent 2 years as an ORISE, or RISE, Monitoring and Evaluation Fellow in IAS. In this role, she provided technical assistance to FDA's performance monitoring efforts and to the international food safety partners, including the Global Food Safety Partnership, Standards and Trade Development Facility, and Codex. Prior to her work with FDA, Ms. Meck was an Associate Program Officer at the National Academy's Institute of Medicine. She holds a master's degree in public health from George Washington University and a bachelor's degree in international relations from American University. Well, I'm going to go ahead and turn it over to Mara and Kate. We will take questions at the end of the call, so and I'll talk a little bit about how to ask questions at the end. Let's go ahead and get started.
Well, thank you, Steve. I appreciate that. This is Mara Burr. Welcome, everyone. Thank you for joining us. We really appreciate everyone taking the time to be with us this afternoon. We had hoped to do this months ago, but there was a little government shutdown that delayed our plans, but now we're back up and running and we're able to reschedule. So we're just really pleased to be able to do this, and I really encourage everyone, if you have any questions at all at the end, to please share those with us, because we want to ensure that we have a really strong mechanism for us to be able to communicate on a real-time basis. This is a really important program for CFSPAN, for FDA, and so we just want to make sure that it's working as intended, and that we are able to address issues that come up, sometimes unexpectedly. Sometimes we do have some warning that issues are on the horizon, but we just want to make sure that we are communicating in real time and exchanging information. Our presentation goes a little bit over export certification. I know many of the food and drug officials are engaged in export certification in the states. In some states, it's handled by the ag departments. But this isn't a new topic, but what FDA's program has done is provided the foods program with statutory authority to issue export certification. So the first slide Sorry, a little technical difficulty. Here we go. The first slide just gives you an overview of export certification, which I think most of you already have. Many countries are requiring export certification in different forms, some in the form of cert, some in the form of lists. We're just going to focus on the export certification that was provided to FDA, CFSAN in the Food Safety Modernization Act, and specifically Section 801E4 that was updated to include foods. So this gives you an overview of the historic requirements, providing assurances about high-risk foods. But as I was mentioning, we're seeing more and more countries requiring some type of certification. It's unclear what the root causes are for this, but we know that more and more countries are notifying certification requirements to the World Trade Organization, or are implementing certification requirements either for the domestic or the exporting country to provide, or for the exporting country to provide based on importing country requirements. This just goes over some of the export certification challenges, which I think most folks are familiar with. Some of the issues that have been challenging for the foods program are when countries required some very specific language on certification, or required additional information on certification. This gives just a quick overview. In 1996, the FDA was provided export certification authority for all of the centers. It was not provided to the foods program. And as a service to industry, CFSAN did develop a program to issue certificates of free sale. And at the same time, many states are also offering export certification, and again, it varies between the Food and Drug officials or the Departments of Agriculture. I know in some states, actually both have a hand in it, but that's actually predating any of this authority. Export certification is going on for a while. And this just gets to the heart of the presentation today. We wanted to be sure that folks understood the Food Safety Modernization Act of 2011 extended the statutory authority to provide export certification to the foods program. So it added foods actually to Section 801E4 of the Food, Drug, and Cosmetic Act. And the challenge for CFSAN was to ensure that our export certification program was consistent with how the other centers had implemented the same statutory requirement that was provided by Congress in 1996. So not only was it implementing the FSMA provisions, but it was ensuring consistency across the centers. And as we were preparing for this, we wanted to make sure that for foods, for the food centers, CFSAN, the other centers include the centers that deal with drug evaluation and research, that deal with biologics, the Center for Veterinary Medicine. So there are a number of centers that comprise the foundational aspects of the Food and Drug Administration. And just to provide that perspective, that those centers have been providing export certification for quite some time. It was CFSAN and the Center for Veterinary Medicine that fell under the provisions of the Food Safety Modernization Act. The two types of certificate, the certificate to a foreign government is probably the most like a certificate of free sale because it certifies that products may be marketed in and legally exported from the United States. There's also the certificate of exportability for an export-only product, and this means that the product is not going to be sold in the U.S., but it does meet the requirements of 801E1 of the Act and can be exported to a foreign country because it meets the requirements of that country and the importer. And this has a long history. It actually goes back to exports of drugs that would not be allowed to be sold in the U.S. but could be sold in foreign countries. So similarly with some food products, they may be made for export only. The certificate of exportability would address that. And this just lays out the benefits of the new certificates. I'm going to let Kate Mack take over at this point. She has much more experience in the day-to-day operation and the issuance of the new certificates and the time it takes from the date the application is received to the actual issuance of the certificates. But I just want to underscore how important this program is to CFSAN and to FDA, and we really are trying to make this the most user-friendly we can and to really support U.S. industry. So it's very important that we understand what we can do better, what you're hearing, and we are very attuned to what foreign governments are doing, what they're requiring, and we want to be able to make sure that industry is aware of that and that we are providing the best service possible we can to ensure that our exporters are able to meet the requirements of the international marketplace. So let me stop there and turn it over to Kate.
Hello, everyone. If you were at all familiar with the old export certificates that FDA used to issue, and we do currently still issue the old style certificate of free sale for some product types, then you'll be aware that industry didn't really love them. So the benefit of our new certificate program is that these certificates offer a consistent format and attestation across product types. So right now, the certificates are available for all conventional foods, including seafood, food additives, food contact substances, and infant formula. And the formats are all the same. Previously, they were different based on the program office that was issuing them, and now we've made them more consistent, which importing countries have seemed to enjoy. The new certificates also have stronger attestations. Our old certificate of free sale was decidedly not a true certificate of free sale in that it didn't certify that the product could be freely sold in the U.S. But as Mara mentioned, the new certificate to a foreign government contains very strong attestation that not only does the product meet U.S. requirements, but it may be freely marketed and legally exported from the U.S. Another area where we really tried to improve the certification program is to offer some flexibility to address the different requirements that we're seeing in different importing countries. A lot of countries have a very specific requirement for a, quote, certificate of free sale, end quote, or a, quote, health certificate, end quote, or for specific data elements. I was just working with the UAE this morning, and they want some very specific information about each shipment in order to be able to tie the certificate to the shipment when it hits their border. Our old certificates had no options. You put the product name on there and the manufacturer name, and that was it. But as I'll get into a little bit later, we've added a lot of data fields that are completely optional on the certificate, and exporters can use these fields when they're required by the importing countries to provide the information that the importing country wants. FDA doesn't really care what you put on the certificate, I mean, except for the fact that it's factual, but we wanted to allow exporters the opportunity to provide the information that importing countries want. The average processing time for the new certificates is less than 2 days. Most are processed in 1 day. If we have to go back and forth with the company about something that they've requested to add to the certificate, it might take a few more, but we're able to turn most requests around in the same day. Industry requests these new certificates via the CFSAN Export Certification and Tracking System. We call it CFSAN ECATS for short. And all certificates are issued via PDF and downloaded directly from the system. So you put the application in electronically. After we process it, you get an email that says your certificate is processed and ready for download, and you can log in and, print a copy of it. You can print each copy as many times as you want. The general period of validity is 2 years from the date of issuance, and FDA does not care whether or not you use that certificate once or 52 times. As long as the importing country doesn't require new certificates with each shipment, you can reuse it as many times as you want. We also have a portal through which foreign government officials can verify the authenticity of certificates issued by FDA. So if you're in Turkey and somebody hands you an FDA-issued export certificate and it looks a little funny, you can log into our system, put in the unique ID, and see a copy of the certificate as actually issued by FDA. And there are some countries that use our system all the time, and there are others that just check up every once in a while, but they like having that ability to verify the certificates. Our current certificates are limited to, well, we currently limit the requesters to 25 certificates per application in SIFSA and ECATS. And for each application, you can put up to 25 products on one certificate, or 25 certificates. It just gets to be a lot of pages after 25 products, and we'd rather just issue a new certificate there. So here are some of the flexible options that we're providing in terms of entity information. You're seeing kind of a screenshot of the certificate on the right. And we received a lot of requests from industry. They didn't want the manufacturer name to be on the certificate. They wanted the exporter name to be on the certificate, or they wanted the distributor's name to be on the certificate. So we decided to allow them to request to print up to 2 names and addresses, and we allow them to identify up to 4 entities. So you can print the manufacturer and the distributor name, or you can print the exporter name and the distributor name. It's really up to them. And where countries have requirements for specific information, we publish that online in our export library. We just launched that this week. It's not very full. We're still fleshing it out. But we intend to provide guidance on, you know, hey, we know this country requires the manufacturer's name, so make sure that you select to print that on the certificate. With regards to the product information, this certificate is simple. It only contains 1 product. But the 4 fields that you see below the product name, those are all fields that can be customized by the applicant. So we have a bunch of different fields in the system. Like I said, most of them are optional, but the applicant can choose to fill in whatever they want, and then they can also choose which fields actually get printed on the certificate. So if your country doesn't require anything but the product name, you can leave everything else blank and just print the product name. But if you're shipping to UAE, for example, and they want to know the production date, the expiration date, the type of packaging, and the quantity, you can specify that here. And the final area where we've provided some flexibility is with regard to shipment information. So we've pre-programmed a bunch of fields into the system, such as the importer name and all the address fields, container number, place of loading, port of entry, lots of different shipment-related fields that are optional on FDA's side, but if the importing country requires it, you can fill them into the system and have it be populated here. We also just have a free text box, and that would allow you to put any information in that we haven't thought of, that we haven't programmed into our system yet, or if the country requires some additional type of attestation, we can use this field to address that concern without having to develop a completely new certificate template. And I'll give you an example of that. Canada came to us last year and said, we just passed the Safe Food for Canadians Act, and under the Act, products containing small amounts of meat will now require certification. Now, where these products are under FDA's jurisdiction, Canada didn't require any type of certification. So we said, hey, we've got this certificate to a foreign government, will that work? And they said, well, we're really concerned with the products containing poultry ingredients, and so we'd like you to provide an additional attestation related to the heat treatment of poultry-derived ingredients. So instead of having to create a whole new custom certificate for them, which if any of you have IT systems for your programs, you know is quite complicated, they agreed to accept this additional information on heat treatment in the additional information box, and we can just continue to use our same system for issuing these certificates for Canada. We do charge fees for certificates that are issued under Section 801E of the FD&C Act. The statute allows us to charge up to $175 per certificate as long as we issue it within 20 business days. As I mentioned, we're issuing them much quicker, but the statute allows us 20 days. FDA CFSAN charges $175 for the first certificate. So if you fill out an application and request one certificate, you're charged $175. If with the same application, you're requesting 2 certificates, then the second certificate gets charged at a lower rate of $155, and then any of subsequent certificates are charged, you're charged $100. Talk to us. Mara was correct that we are always open to feedback as to how we can improve our program and how we can better facilitate U.S. exports of FDA-regulated products. We hear a lot from exporters about problems that they're facing with importing countries. You know, if a country's refusing to accept a certificate or challenging the authenticity, if they reach out to us, we can work directly with our FDA offices around the globe or our interagency counterparts in FAS or USTR if needed. And we've been able to resolve a number of misunderstandings in the last few months since we launched the program. So we're pleased to report that we've had no instances of importing countries rejecting these certificates. In fact, they're quite pleased with them and the ability to accommodate additional information on the certificate as opposed to in separate documents. So we're always looking for ways that we can improve and make this process easier for industry. So if you hear anything from your folks, feel free to contact us. This is our general email address and phone number, and my team handles all inquiries that go through those channels, and they'll route them to Mara and I as needed.
Well, thank you both very much. I think at this point we're probably ready to go to some Q&A. Do we have any questions? If you have a question, you can actually raise your hand, and that should be, I believe, if you just hover over your name in the participant box, or you can actually probably unmute yourself and ask your question. Do we have any questions out there? And Amy, if I'm wrong on the instructions, help me here. We'll give folks just a second or two to do this. From what I recall, oh, yep, go ahead.
Hey, Steve, I'm not sure if there is an unmute button, but I will unmute everyone, and if you have a question, you can go ahead and ask it.
Okay, great, thanks. Do we have any questions? Do we have any questions out there? Any questions for the team? Maybe I'll just start with one. If I recall
Hey, Steve, this is Philip.
Oh, yeah, Philip, go ahead.
Hey, is there any way that we could maybe get like an example copy of what the export certificate reads? So if we do certificates or something here in our state, we could maybe modify the language to kind of mimic what they both say. Great question. Who wants to take it? Mara or Kate, one of you? Okay. Yep.
Thanks, Dave.
Go ahead.
Absolutely. So with respect to the copies of the cert, we're happy to provide you with blank certs that you can take a look at and review and sort of get familiar with the way they look. I mean, to the extent that, you know, a state wants to use it as a template, that'd be fine. The only, caveat obviously is that, only FDA can certify to compliance with the U.S. requirements with respect to, what is required by the federal government. But, I mean, if you wanted to follow a similar path with respect to compliance with state requirements, certainly if you'd want to pursue that, we wouldn't have an objection. It's just the jurisdictional issue and how we have the language on the certification, which, would be something that there's a divergence between the states and FDA.
Yeah. No, that would be great. And maybe if what we can do is we can go ahead and maybe make that available with the actual posting of the webinar as a sample, so everyone can take a look at that.
Certainly, Steve. We can provide that to you to share with everybody.
Okay, great. Philip, any other questions?
Hey, this is Natalie Adan with the Georgia Department of Agriculture. What type of requirements are you looking at prior to issuing that certificate? Are you making sure that they're a registered facility? Are you looking at past inspection history? What type of requirement?
Hi, this is Kate. I'm happy to answer that. The requirements vary slightly depending on the type of product, but you've hit the first two steps generally on the head. We're looking at, for facilities that are required to register, and that is most but not all food facilities, we're verifying that they are registered as required in the food facility registration system. We're also looking at inspection history, and that's the start of it, but we also go into their compliance history a little bit and make sure that, we're not looking at any recalls or open warning letters or any other type of investigation into the facility. From there, we do look at the product information. So at a minimum, we're looking at the product label, particularly for the certificate to a foreign government, which certifies compliance with U.S. requirements. We are verifying a link between the product that they want to have certified and the manufacturer that they've identified on the application. We don't want to be issuing a cert and have no evidence that the two are related. And for certain products like infant formula or food additives, we are verifying that the specific product meets the requirements for that type of product. So for infant formula, FDA has separate registration and notification procedures. And for food additives or food contact substances, there are a number of different regulations that may cover those products. And so we're just checking all the boxes and making sure that before we say the product meets U.S. requirements, it actually does.
Great. So I guess one follow-up question I might have to that is, let's say it's a relatively new registrant and they don't have any inspection history. How are those sort of firms handled?
Well, we are willing to accept evidence of inspections by other federal agencies, state agencies, even local agencies, as long as somebody in some regulatory agency in the U.S. has inspected them from a food safety perspective, and it's generally applicable to the type of product for which they're requiring certification, we're willing to consider their application. So we get a lot of companies that upload state inspection reports. We get a lot of local inspection reports from the state of California because I understand they kind of delegate down. And for seafood, for example, we often get reports from NOAA through their seafood inspection program. So we are open to accepting other inspection reports, and in the future there may be other avenues through which we can obtain assurances about their compliance with U.S. requirements. But right now it's essentially an inspection by a government agency.
Great. Other questions?
Hey, this is Matt Colson with Florida. I'm just kind of piggybacking on that last conversation, I guess. Are there any criteria on time frame since last FDA inspection, and I used to get called all the time about export certificates from FDA, calling to ask about our most recent inspections at a facility and whether they were in compliance with us. Is that still occurring?
We, as you know, FSMA provided new timeframes for FDA to inspect or provide oversight for our food facilities. And we have kind of adopted the FSMA timeframes as, you know, when we're looking for the last inspection. So that can be anywhere from 3 to 7 years. With regards to, are we contacting states directly? So when we review an application, we're asking the applicant to provide evidence of a recent and satisfactory inspection. So 99% of the time, they give us an inspection report from a state facility if they don't have an FDA inspection on record. Only a few times have we had to reach out to states because we had questions about the inspection report, or we wanted to better understand, you know, the state's process for conducting inspections. We recently spoke to California and learned, you know, we were hearing from exporters that there wasn't an easy way for them to get their inspection reports, and we spoke to somebody in California, and they said, actually, all they have to do is file this Public Records Act. It doesn't take that long, yada, yada, yada. So we don't reach out directly unless there are questions that we have or we want to better understand something that's been provided to us. You may hear from exporters or manufacturers that would like to obtain a certificate, and they may ask you for a copy of their inspection report. But you probably won't hear from us unless we get something super weird.
Other questions? We'll do a last call for any additional questions. Kate and Mara, anything else you'd like to add today?
Yeah, thanks, Steve. I mean, just for the folks on the phone, I mean, what we've been hearing from industry, you know, across products is that there is a need for some type of certification that says they are in compliance with the requirements of, you know, the exporting countries. So the FDA certification does provide that, you know, it provides the company with documentation that, you know, as of the date that we issue the certification, that they are in compliance with the FDA requirements. So, you know, we are hearing more and more from exporters, from industry, that this is a useful certification for them to provide. I think Kate touched on, you know, what the certification looks like. We will provide that again to you so folks can look at it. There are some fields in which manufacturers can add information. Manufacturers or exporters can add information that is specific to the country for which they're exporting to. And we did hear from industry about, at least for some countries, to have a subtitle that said Certificate of Free Sale under the heading of Certificate to a Foreign Government. So we were able to accommodate that specific request as well. And I guess I'm providing this information because we do know that things change. Sometimes they change quickly. We do know industry sometimes will ask for states to issue the export certification. Sometimes they'll come to us. And so it's important that, you know, we understand why, you know, some of these requirements are being requested, but we do have some flexibility to address, you know, specific requests from manufacturers or exporters with respect to certain countries. You know, in some cases, we are seeing, you know, shipment by shipment certification, which is different than a 2-year certificate. So there are a number of different requirements floating around out there, and this is really our attempt to, at least for FDA's side of it, to provide certification that is actually helpful and meaningful and allows our exporters to gain market access in countries. We have not, had any issues with respect to our certs not being accepted. We have had questions about certification when the new certificates came online. We tried to do as much outreach as we could. The program launched on October 1st, 2018. So as you know, we had October, November, and part of December before the federal government shut down for a period of time. So there was a break in our ongoing outreach efforts. So this is really helpful today to us. We hope to work with you to continue the outreach. But again, I think as Steve mentioned in the beginning, we do want to have an ongoing dialogue. So if there are things that industry is talking to you about that you think would be helpful for us to know, or if you have additional questions, or if other questions come up from industry, we really want to hear from you, and we want to have a partnership where we address concerns. This is an important program for us. We want it to be effective. We want it to work as intended, but we also want to ensure there's flexibility to address issues that we could not have foreseen as we developed the program.
Hey, I did have one more question. I think you had mentioned that you've developed a list of the special requirements for the various countries. I'm just curious, is that list available on the website? I know that often states get the same, very similar sorts of requests, and might be interested to see what request you'll grant and how you all approach it. Is that publicly available, or is that something that if we have a specific question, we would need to reach out to you all on what you're doing with a specific country?
Hi, this is Kate. We did just this week launch the FDA Food Export Library. The only country for which we have posted information is Canada, because as I mentioned, we recently negotiated, their acceptance of the certificate to a foreign government with some specific data elements and some specific language. So you can check that out if you're interested. There's also specific information for dairy, seafood, and infant formula, and collagen and gelatin exports to the U.S. That's not in the library, but those are countries that require export listings and have very specific requirements for certificates as well. And I'm working on, about 5 other countries that we want to upload specific information for, just confirmed some of UAE's requirements. So you can bookmark it and go back to it as you have questions. You can always reach out to us if there's something on there that you're not aware of. And I'm also going to link to the export libraries of other federal agencies. APHIS has an export library for the products that they regulate. They also issue some certificates for FDA-regulated products that contain animal ingredients. Also, FSIS has an export library. And USDA FAS regularly publishes GAIN reports. I'm not sure if you're familiar with those. And they have a certification report that details, what a country's specific certification requirements are. We're not trying to duplicate any of the things that are out there from other agencies. We plan to use our export library to provide specific information that we've heard from countries that are accepting FDA certs or requiring FDA certs, and they're requiring something different, whether it's data elements or language.
That's great. We'll also include a link to the export library with the recording information so that people can get to that quickly. Well, any other last questions? I'm not hearing any other questions, so with that, I think we'll go ahead and wrap up, and we'll thank Kate and Mara for joining us this afternoon. We appreciate all of your participation, and early next or sometime next week, we'll be sending out a link to the recordings for all of you that would like to take a look. Thank you again for participating, and thank you to our presenters. This was a great opportunity, and we appreciate their time and putting together this webinar for our state partners across the country. Have a wonderful Friday.
Thank you.
Thanks.
Now, this is so either.